What we're going to find out, first of all, there is a test, Joe. There is a test for, SpectraCell does dynamic nutrient testing. They will give you your Spectrox antioxidant score. They will give you the constituent score, your glutathione, your cysteine, your vitamin E, your CoQ10, selenium. So it will give you the constituents. No test is perfect, but there is a test out there that we can, let me have my say. You had your time. The point is that there are ways of testing this. We will get better ways of testing this. I talked to Aubrey, and Aubrey talked to me about signal path, signaling of, do you need too many antioxidants, do you need not enough antioxidants? What are we doing to our natural production? We will have better ways of testing this. So you see the people who are the high oxidative docs, and you see the high antioxidative docs, the body is way smarter. It's figured this all out.
We have about 10 minutes left, I think, before we break for lunch, and I'd like to hear from the audience as well with questions. I see some over there.
Just has bothered me just a little bit because, of course, I have my anti-aging doctor who I think is absolutely brilliant. He's right here. But I've always wondered about how important is it for your primary doctor, use this person as your primary doctor, to be on staff at your hospital. In other words, you have to go in there and get in there and get a room in there and have somebody there who can monitor your charts, etc.
Well, I run into that problem because I'm not a hospital doctor. So I look for primary care internists and so on who will do that, who are of like mind at least. I mean, at least they're somewhat open-minded. And it's really hard to find, at least in the Santa Monica, West LA area or Beverly Hills, doctors who are, are going to do really good hospital medicine, but not in the old box style. So it's a tough one, and I found a few here and there in Santa Monica and at Cedars, but it's a tough question because I just don't like to go to hospitals. I just don't like being around bugs and stuff like that. I just don't like it. I'm not going to do it. Anyway, I signed somewhere. But I was going to make a question about the antioxidant is not an antioxidant. It's like there's sulfur-based antioxidants, which I think a lot of people do not get enough of. And it's my sort of intuition. When people in the old days went to sulfur baths, they were getting sulfur, but they were also getting some sort of sulfation effect, which increased phase 2 detoxification system, which is all sulfur-based, like MSM, acetylcysteine, methionine, and a bunch of other amino acids. So you've got, and then the other question is about testing. I think Metametrics does a pretty good test on ionic organic acids, and it tells you, it's kind of like looking at a car. A brand new car has clean exhaust, right? But as you get older, that older car has dirty exhaust. Well, it's sort of going upstream and finding out through the Krebs cycle, whatever, what are you missing, what's wrong. It's not perfect, but it's better than nothing.
Comment on the SpectraCell test, which I had done actually earlier this year, and it was actually one of the few tests that they had. It was absolutely perfect, not one deficiency. And I attribute that to the fact that I have energetic testing on my supplements that tell for me what is good for me. Now, another antioxidant I forgot to mention is the antioxidant. And 1 out of 4 people in this room have too much of it. What is that? Iron. If you are a postmenopausal woman, if you are a man, you have to have your ferritin levels checked. It cannot be higher than 80. The way to lower it is therapeutic phlebotomy. Get it down to between 20 and 80. It will ruin your life. It will accelerate cardiovascular disease. It will increase your risk for cancer. It's bad news.
Now you know the real reason why men die sooner than women.
Well, that's a good question, but I guess I'm back to the question of the fish oil question. You can measure via blood spot test at home your EPA arachidonic acid ratios. You can also measure EPA to DHA ratios, and this is all possible. So, and a red cell is worth about 90 days worth. So these ratios are all available to us. So we can find out. And we also look at lipid peroxidation. I mean, that's all available in the urine. You can also look at DNA damage. You can see damaged DNA. So all these things, these kinds of tests should be done. These are, any good anti-aging doctor should offer these. And then the Berkeley new lipid panel will tell you about the KIF gene. The KIF gene 6 is propensity to cardiovascular events. And that KIF gene, if you are carrying it, you will respond very well to a statin-like drug or whatever. You've got the allele of its arginine, whatever, I can't remember. But then it also does tell you about aspirin. There's another test what SpectraCell does about aspirin resistance. In other words, you can take aspirin, but it doesn't work. SpectraCell offers that. And then these other thing about the also ApoE genotyping, I think is important. So if you're a 3-3, you're good. If you're a 4-4, you're bad. And if you drink alcohol, you actually will get the reverse effect on HDL cholesterol. It's going to go down rather than go up. If you're ApoE 4-4, which is the bad news, ApoE genotype.
Does anybody want to speak about the topic of vitamin D3, which is a hot topic in the last year?
Let me start out, because everybody wants to talk about this. I have done a huge amount of research on vitamin D3. For the last 2 years, I've been fortunate enough to be in contact with all the world's experts. Why? Because there's no money in this. And because of that, the experts in the world, the very few of them, do it for the love of the subject. I was trying to figure out what the right dose for vitamin D is and what's the right level. And I came upon, for virtually everybody, there are some exceptions, for virtually everybody, minimum is 5,000 units a day. That's minimum. Nobody will get toxic. I have patients who have been taking 50,000 units a day for months, which will look like it's toxic. I still don't see the toxicity that every one of us was taught in medical school, which is if you eat polar bear liver, you will die of vitamin D toxicity.
I remember.
Everybody knows this story. Maybe there's polar bear liver, but you don't overdose in vitamin D. I have lots of patients who need 50,000 once a week, 5,000 units on all other days. I have patients who are on 15,000 units a day. The minimum is 5,000 units a day. Vitamin D protects us against osteoporosis, breast cancer, prostate cancer, heart disease. It elevates mood. It probably has anti-infective properties.
Yeah, I would agree with that. I've also interviewed almost all the major experts in the world, and one of the key people, I forgot his name already, but no, not Hollick. I think there's a lot better people than Hollick. Although, I'm sorry?
Feith is probably the top.
Feith. Well, yeah. I mean, he's done some things that just disturb me. Well, I've actually got sued by Quest for this whole issue because there's a huge problem. I got sued big time by Quest for announcing some of the challenges they did with the testing of vitamin D, which is, to me, medically reprehensible. Because the testing results, the only way, there's a tremendous variability in the dose. 5,000 is the dose?
No, there isn't.
Well,
no, I can almost predict for virtually everybody, there are outliers, but for virtually everybody, I can predict that 5,000 units, most people will be between about 50 and 60 nanograms.
But there's
most
still,
people.
but there's still a subset of people who may need that 50,000.
The laboratory testing isn't good, like Joe was saying.
Well, the laboratory, that's what I wanted to comment on. The laboratory testing is decent, and that's actually why Dr. Robert Heaney, who's probably the top expert in the world on vitamin D, he's one of the pioneers. He told me once that 99% of what we know about vitamin D was only learned in this century, and that's because of the testing that we have available, and now they're doing the studies on it. But the point is that you want to get it between 50 and 60 nanograms. If you're below 50 nanograms per milliliter, and you multiply that by 2.5, if you want nanomoles per liter, then you're probably deficient. And you're going to need at least 5,000. If you're a child, which is a common question in our because we have a lot of mothers on our site, the dose is 35 units per pound per day. And that's in a close approximation. If you're sick and if you have not been taking vitamin D therapeutically, you can use it in a high dose, maybe 50 to 100,000 units a day for 3 days. That will stimulate the release of between 200 and 300 antimicrobial peptides, which are profoundly effective. Vitamin D therapy in the form of heliotherapy was used, or UV light therapy was used over a century ago to treat tuberculosis effectively. So it's profoundly beneficial. It is the single most important nutrient that you need, that you can be on, and I think it's medically reprehensibly negligent if you are not measuring your vitamin D levels. You've got to do that in all your patients, and the caution here is to use LabCorp. They are of all the commercial labs. If you use Quest, for whatever reason, you have to divide by 1.3. Otherwise, you will get a falsely positive number. They'll come back with 70, and actually it's like 45. You've got to divide by 1.3. It's just, I mean, they should go to jail for this for the rest of their lives. These people I cannot believe how they're getting away with it. It's just.
I'll agree to that, Joe, because I've gotten letters from Quest about even their IGF-1 testing has been totally wrong. Their thyroid, their T3 measurements have been wrong. Their vitamin D levels have been screwed up. I don't use them anymore. I go to LabCorp, or that's about So I just do not trust Quest.
I'd like to have the audience thank all of our panelists this afternoon and.